All right, it's time to talk about smoking, smoking cessation in particular. Dr. Brent Wallis, the Chief Medical Officer of People's Health, is with us. And Dr. B, I tell you what, I'd like to tell you my story about smoking cessation. And you might want to put this down in your case histories and maybe use it at some point, but it's about my experience smoking and how I quit. I was a smoker for 13 years, started in the military, got out. On a normal day, I would go through 2 packs. On a day when I got up early to go duck hunting and went to work and didn't get off till 10, I'd go 4 packs a day. I was what you'd call a heavy smoker. In the spring of 1984, last day of turkey season, I was hunting a turkey, a particular bird I had been after all year. And on the last day, I had given up, and it was about 11 o'clock. And I was driving out, and I saw the turkey standing in the road. I jumped out of the truck, ran into the woods. He ran in parallel. I started calling and worked him for about an hour. Didn't hear him anymore. Started raining. My paperback matches got wet, and I could not light a cigarette. I talked myself out of staying for that turkey. And if you're going to be successful, you got to hang in there. I got up. And as I stood up, the turkey was no more than 30 yards away. In a matter of seconds, if I had stuck in there, I would have bagged the turkey of a lifetime. So at that point, I threw the matches away, I threw the cigarettes away, and I swore that if something had control over me and prevented me from doing something that is one of the most passionate things in my life, it was time to quit. And that was in April of 1984, and I have not smoked a cigarette since. I think the moral of the story is the proper motivation. I mean, there's things you realize it's a health issue or it's a money issue. It's very expensive. It ruins your clothes. It's a nasty habit. But in my case, that was the one thing that drove me to quit. And I think if people find that, they would be able to quit. But you got to have the right motivation. Am I right, Dr. B?
Yeah, definitely. That's a great story, too. It's actually, I think anyone who has smoked and has quit usually has a story like that, kind of what finally triggered them to say, okay, enough's enough.
Well, the story gets better because I wrote a magazine article that was published, and I won an award for it called Quitting Smoking Cold Turkey, if you get it.
That's great.
You couldn't make it up. It was a true story. Well, let's talk about smoking. And it's been a while since, it comes out on all the cigarette packaging now, which when I started, there wasn't any real major health concerns. We didn't think it was good for us, but we didn't realize all of the dangers. If you could kind of go over the problems associated with smoking.
Yeah, sure. So like you said, most people know these things, but I think it's, there's a few things you may not realize. There's just tons of problems with smoking for the individual that smokes as well as the people that are around them. I mean, obviously we always think of cancers, things like lung cancer, but it can actually also cause other types of cancer, gum cancer, mouth cancers, head and neck cancers, and then can really increase your risk of heart disease or stroke, and then certainly lung diseases like chronic obstructive lung disease or emphysema even. So, some pieces people don't realize, though, it actually does prematurely age you. It can wrinkle your skin, and for men, it can even cause erectile dysfunction. I usually use that one when I'm talking to my male patients. And one of the other things that's really important is it affects everyone around you. It can affect children and babies. Smoking is actually responsible for sudden infant death syndrome, low birth weight, and even preterm deliveries. And then obviously asthma can come along with that if you have a parent that smokes while you're growing up. So that exposure to secondhand smoke can really increase risk for anyone who's around you who's not the one who's smoking. It can increase their risk for heart disease and other types of cancer as well.
What do we know about the relationship between the coronavirus and smokers?
Well, they're definitely at a higher risk. When you smoke, usually you have a baseline level of lung disease. You could even have advanced lung disease, like I mentioned, COPD or chronic obstructive lung disease. And so that actually puts you in a much higher risk group. So while there certainly is a recommendation for everyone to get vaccinated, smokers are at even an increased risk. And if they do get COVID, they're more likely to have more severe illness.
Very good. If you would, Dr. B, stay with me. We're going to take a quick break. When we come back, we're talking about quitting smoking, the cessation, and maybe you've got some ideas what works best. For me, it was a turkey that stopped me from smoking. I've got some text messages coming in with people who say why they smoke, what their motivation was, and I'd like to hear from more of you. You can use that Oakland Heart Jewelers Talk and Text line, 504-260-1870. Back with Dr. B, the Chief Medical Officer of People's Health, right after this. Our guest is Dr. Brent Wallis, Chief Medical Officer of People's Health, and our topic is smoking cessation. And I'm getting some messages in on how people quit and why they quit. One said that they held up their infant son. After smoking for 15 years, the son sneezed, and when he held him, and he gave it up, and that's been 8 years ago. Another burned a hole in a pair of pants and smelled the burning. That was it. Quit. Last one. So we got a lot of good motivational stories about people who quit smoking. Dr. B, some people are hesitant. They make excuses why they don't want to quit. And I got to admit, I've done it, and it's one of the hardest things you'll ever do, whether you're physically or just habitually addicted to smoking or both. It's not an easy thing to do. So they kind of look for ways to avoid quitting, but at the same time do things that are healthier. And they're talking about some healthy cigarettes or going to the electronic cigarettes. What can you tell us about those substitutes?
Yeah, electronic cigarettes, become very popular, unfortunately, among children even. And the way they work is they basically heat up a liquid that produces a vapor that can kind of mimic smoking. And that vapor can have nicotine in it or not. And, the jury's still a little bit out. There's a lot of research being done. There definitely are electronic liquid vapors that have a lot of the same chemicals that cigarettes do. So it's definitely not entirely safe. The FDA right now is actually in the process of developing regulations for those e-cigarettes.
You know, I'm a little more sympathetic than a lot of people about anti-smoking. I'm not an anti-smoking Nazi. I don't get on people because I understand how hard it is to quit. I've also heard people tell me that, well, I've been smoking so long now, the damage is done, why quit? What about coming back? How long does it take for the body to heal itself after smoking cessation?
Yeah, your body is amazing. It does heal pretty quickly. When you stop smoking, one of the first things that happens is your heart rate starts to go down because smoking increases your heart rate. So in just really 20 minutes, that can actually regulate. And within the first day, your oxygen levels can return to normal. As you kind of progress, if you can keep them away for 2 weeks, your risk of heart attack drops. And then beyond that, actually, your lungs can start working better. When you get out to a year without cigarettes, your risk of heart disease really drops by about half. And then in 5 years, your risk of stroke actually goes back to what it was for a non-smoker. And then really 10 years out is what we say that's where your risk of lung cancer actually drops down to the risk of a non-smoker. So it's not for nothing. If you quit now, you definitely can see some significant improvements before you develop disease.
How long can someone expect to experience the addiction or the want to smoke? I know the way it was for me, it was like almost every day I wanted a cigarette. I would do certain things in a routine, and normally I'd light a cigarette. And gradually it lessened and lessened. But I got to be honest with you. After 10 years of quitting smoking, every once in a while I'd automatically reach for my pocket. How long does it take to break that addiction?
Yeah, that's a very good point. So there's both physical and psychological addiction. So the physical addiction usually only lasts for a couple of days. Nicotine can get out of your body definitely within about a week. So those actual physical addictive properties go away, but the psychological addiction can really last forever. There may be things that actually trigger you, situations you put yourself in. For some people, for example, going to a bar and drinking alcohol may trigger them to want a cigarette. That can actually last the rest of your life.
Yeah. All right, good advice, and we got more coming. Stay with us. We're going to take a news break. When we come back, we'll talk about some of the benefits, some more of the benefits of quitting smoking, and also how to get started on quitting smoking and some help you might want to get. We're talking with Dr. B. He's the Chief Medical Officer of People's Health. And also keep those texts coming on our Oakland Heart Jewelers Talk and Text line. I'm really enjoying these reasons, the motivation a lot of our listeners had for quitting smoking. We're back right after the news.